This is Dr. Daniel Paul with Easy Orthopedics, and today I'm going to talk about what is sciatica and how do you get rid of it. So, sciatica simply is irritation of the sciatic nerve, which is the largest nerve in your body, which comes from a bunch of nerve roots in your spine and it runs down the back of your leg. It's responsible for the movement of your hamstrings and a lot of sensation and muscle function in your lower leg. So, normally when people have sciatica, meaning their sciatic nerve is irritated, it causes pain that travels probably usually from around their butt area all the way down their back of the leg, even into the bottom of their foot. So that's what sciatica is. So the question is, what should you do about it? Well, the first thing you got to know is sciatica just means that the nerve is irritated, but you got to figure out why the nerve is irritated. So there's a few different reasons. So starting from top down, you could have a herniated disc in your back that's pushing on a nerve root and will irritate a portion of the sciatic nerve. So it could be coming from a disc in your back. It could be coming from, sometimes you'll get bone spurs in your spine as well. We call it spondylosis. That'll push on the nerve also. Sometimes your vertebrae aren't quite lined up right and they move a little bit. That can do it as well. And that's just all processes inside the spine. Once you get out of the spine, sometimes there's a muscle called the piriformis, which can really squeeze that sciatic nerve. The sciatic nerve comes out right below it, and if you have a tight piriformis, it can squeeze it as well. You can also have inflammation from the sacroiliac joint, or rarely you could have a tumor or some sort of mass. The point is that something is irritating this sciatic nerve as it's traveling down, and a nerve is almost like an electrical wire. The signal just transmits. So you really have to find out why that is. If you're having back pain, maybe it's coming from your back. If your pain is just inside your butt, it could be coming from your piriformis, and so on and so on. So that can be a tricky area to diagnose. So I think it really helps to see a doctor to figure out exactly what's going on. And I would say preferably a musculoskeletal specialist so they can determine, is it coming from your back? Is it coming from your piriformis or what? You may need advanced imaging. You may need an MRI to determine that. Once you've figured that out, then you can get the appropriate treatments. Most of the time, physical therapy with some stretching and activity modification and some anti-inflammatories can help a lot. And that's generally where you want to start. And depending on what kind of pathology you have, you might want to try, the next step may be steroid injections. And then rarely, if it is coming from your spine, then you may get surgery to remove that disc, or if your vertebrae are moving, you may have surgery to fuse your spine. But that's way at the end. Most people get better with physical therapy and just some time and rest. But yeah, the first thing to do is find out what's causing it. I hope you found this video informative. If you have any questions about the sciatica that you may be having, feel free to leave your questions below and I'll do my best to respond. Otherwise, subscribe to my channel. I put out new content every week, and hit that like button. Thanks for watching my video.